Okay. So I think we'll go ahead and get started. I'd like to welcome you. I'm Sue Flockey from the Prevention Research Center for Healthy Neighborhoods. Welcome. This is our monthly seminar series. And we have our seminar on the second Wednesday of every month. This is kicking off our current year. I did hit record. I think that we're actually recording. There's a lot of work that goes into preparing these presentations, and at the start of this year, I really do want to call out Susan Petrone, that really does help with a lot of the technical work, and you'll see we're taking pictures throughout, but also helps us get set up here. And then Lauren Bottoms, who also does an enormous amount of work, and she will be bopping around, but assists in terms of helping us contact presenters and working through a lot of the logistics, and also offering up this delicious food that we have to entice you to come and stay for our sessions. So I do want to acknowledge those two folks, as well as others who have contributed to the thought about who goes on to this panel. For our presenters, we have the new list. You can get a sheet outside. You've probably already received this electronically of upcoming speakers for this year's series. Today's speaker, many of you know well, is Darcy Freedman. Darcy is an associate professor in the Department of Epi Biostat. She is one of the core faculty and associate directors of the Prevention Research Center for Healthy Neighborhoods. And her work has been focused on food and food access in a variety of different venues. And this project that she's going to present today was actually a really interesting one, an opportunity that cropped up and probably went well beyond initial ideas of where she thought it might go, and has really taken on a life of its own and has been adopted nationally, if that's fair to say. So this is a real treat to get to hear the story behind FM Tracks, where it started and where it is now and where it might be going in the future. So please welcome Darcy Freedman. I also want to remind that we have live tweeting.
Yeah, and I'm normally the only tweeter, so since I'm presenting, I need some backup.
Is that helping? Yes. You want those down as well? It's okay? Okay, great.
Okay, so as Sue mentioned, with FM Tracks, which I'm going to be talking about today, this really was a big, hairy, audacious goal. In my mind, I thought, you know, there has to be a better way to record information about healthy food incentive program use at farmers markets, and technology has to be the answer. And how many people in here are app users, regularly use an app? So a good number of people in here are app users. I actually currently use 0 apps. I'm not particularly technological in my focus, but I thought that this could be an opportunity for change. And so what I'm going to talk about here today was this idea of how do you take a big idea and then work through all the steps to hopefully move the field forward. And I think in the story today about FM Tracks, you'll see that we've moved forward, but it's not been without bumps along the way. And so before I get started, acknowledging a lot of collaborators on this project. As Sue said, this was sort of an idea and then a piecing together of groups of people locally across the state and nationally who would be interested in collaborating to bring the project forward. So one of the biggest collaborators on this project is a national organization called Wholesome Wave, based out of Connecticut. Our development partners on the first phase of FM Tracks has been Prototype 1, which is actually a tech firm based here in Cleveland. We've collaborated with Ohio Department of Health, Ohio State University, Amanda Osborne, and all the farmers market managers in our community. And then a number of people here at Case Western have been working on various parts of the development project. And and a note just about our funding for the project. So we've been funded by the CDC and the USDA. So today I'm going to start off by orienting you to the knowledge to action dissemination framework that was used to guide how we are moving FM Tracks forward. I'll also describe the iterative and participatory methods for developing FM Tracks, highlight a couple of features, and then moving into looking at adoption trends of the technology nationally. And finally, and what might be most interesting to some of the folks here, is looking at our own local data within farmers markets here in greater Cleveland, using the system to evaluate healthy food incentive use at markets. To get started, I want to review a few key terms that underpin the technology. The first term is direct-to-consumer markets. So these are food retail spaces where producers, such as farmers, are selling directly to a customer, such as a farmer's market, a community-supported agriculture, mobile market, or a farm stand. I talk about technology with technology challenges. That should be it. That's the thesis of the whole talk right there. So, so healthy food incentive programs incentivize a purchase, so it's not a free program, and they often incentivize a purchase made with a specific payment type. So, for example, Supplemental Nutrition Assistance Program benefits, or SNAP, formerly called food stamps. And they require the initial transaction to calculate an incentive based on either a matching or discount model. So here in Cleveland, we have a matching model, one-to-one, dollar-for-dollar match up to $10. In other places, they have discount models, so you pay, if something costs, and this is more common with the CSA. Let's say a CSA basket is $20, and you're getting a 50% reduction in the cost, so you're only paying $10 for the CSA with the match. But this matching model adds some complexity to implementation of the program. And then the third part of it is that it requires careful tracking system to reduce errors. And so the last two pieces to me became a major impetus for thinking about technology. Because it's a kind of intervention that if I make an error in recording the number of people receiving the incentive or the amount of incentive, there literally is a price tag to that error. Unlike if somebody comes to nutrition education class, I'm keeping tally marks, I thought there was 10, there were actually 12. Really, nobody cares that much. But if I thought there was $100 and there was really 120, or I thought it was 100 and it was really 80, that difference of $20 can become an impediment for groups to implement, and particularly in areas where you might need the program the most. Most farmers markets across the country have some voluntary nature. They're not lucrative industries where there's a big pot of money sitting around to cover these kinds of errors. And so for me, as I thought about wide-scale implementation of model and making sure that it would become available in places that would need it the most, it seemed like technology that could simplify this process would be advantageous. A third definition I want to highlight is the Food Insecurity Nutrition Incentive Program, or FINI for short. So this was established in the 2014 Farm Bill. It's $100 million allocated to support nutrition incentive programs across the country. They're focused on matching or discounts related to Supplemental Nutrition Assistance Program benefits. They can be used anywhere, farmer's market, grocery store, and they can be used to buy any kind of fruit and vegetable, so canned, frozen, or fresh. Although there's some language in the Farm Bill for a local preference, so locally grown products. Already, of that $100 million, $47.8 million have been awarded over the past 2 years, and Cleveland Cuyahoga County is a recipient as a part of a broader national Wholesome Wave grant. So moving into thinking about how, FM Tracks as a tool that we were interested in disseminating. One of the models that guides the work that we're doing here in the Prevention Research Center is this model called the Knowledge to Action Framework. And the whole idea behind the Knowledge to Action Framework is just because we find evidence that something works does not mean that it gets translated into practice. So that gap between what we know and what we do, and how do we bridge the gap between those two concepts. So in the knowledge to action framework, there are three main phases: the research phase, translation phase, and institutionalization phase. And in this particular project, we are building on an existing literature in the research phase. So there have been a number of discovery level studies that have shown that food environments and food cost is a major contributing factor to healthy diet. And that led into some efficacy and effectiveness studies where they looked at, well, what could we do to address those factors and improve diet? And a number of studies have looked at the impact of a healthy food incentive program, whether it's for SNAP or WIC, senior farmers market vouchers. And so where we're at, and you can hardly see this, but this says decision to translate. When there gets to be a growing body of evidence to say this is an evidence-based practice, or an evidence-based policy, or evidence-based intervention, there can be a decision to translate that, and that does not always happen. But important to note is that that is an active process. So when the Farm Bill passed in 2014, there could not have been a more clear decision to translate. $100 million is going to be allocated to support this line of intervention. And quite frankly, the evidence base for healthy food incentive interventions, I would say, is not the strongest evidence. But there is some evidence to support that, and there was a lot of interest at a policy level to begin implementation. So at the point that the FINI passed, we now move into this stage of translation. And specifically, in that first box, it says knowledge into products. And in this case, one product is FM Tracks. Other products that, for example, our Prevention Research Center is working on is a toolkit, for example, for implementing produce prescription programs in partnership with health centers. That is a form of an incentive intervention, but that would be another example of a product that could go through a similar process of translation. So once something is created into a product, such as FM Tracks, we then move into the process of dissemination. So just because we have a tool doesn't mean it's going to go anywhere. And in our particular work with FM Tracks, and we're speaking with a number of people in the field, it became very clear that for this to be moved forward more rapidly, we needed to be thinking about partnership with a group that was very much connected to healthy food incentive work, not just locally, but at a national level. And that's when I started to begin conversations with groups like Wholesome Wave. And it was interesting to me that Wholesome Wave, as soon as I talked about FM Tracks, immediately was interested in partnering. And I think that goes to show, to some extent, the need for this kind of tool at a broad level. So that confirmation for the need for your technology, and you'll hear a lot about this in the technology arena. There's a lot of ideas, not many of them move forward. And so in this case, we had a dissemination partner specifically thinking about Wholesome Wave. And then we, in this presentation today, I'm going to talk a little bit about how farmers markets across the country were making decisions to adopt that technology. So again, we have a product, we had to disseminate it, but just because it's out there doesn't mean anybody's going to pick it up. And so we were looking at adoption. And then, of course, adoption is going to lead to changes in practice, which potentially feeds back into new research at the basic research level, but also at the translation level. And then finally, we're moving to the point of institutionalization. Institutionalization is adoption of this in the field, sort of as a standard of practice. And you know, I'm pretty excited right now. We have a large network out of the state of California called the Ecology Center. They're interested in including FM Tracks in their new FINI grant. That would bring on about 200 markets in California. And the National Farmers Market Coalition is also interested in bringing FM Tracks on for all of the markets that they provide technical support to. So I think I'm not going to talk a lot about this final stage, but just to sort of get to the end of the story, I think we have signs that we actually are shifting the norms and the practice in the field about how data are being collected and used related to healthy food incentive programming through the FM Tracks technology. So, has anybody ever developed an app? Okay, Jim. So, the method that we used for developing our technology was an iterative and participatory design. And I came to this work as somebody who's done a lot of collaborative, community-engaged, participatory research. I had not done anything around technology development, but I think one of the things that what resonated with me in this development process was that a lot of the things that we do as collaborative, participatory researchers fit squarely in line with this model of design. And so just to walk you through a little bit about our process, at the very beginning stage is this high-level planning. And one of the lessons or the piece of the feedback somebody gave me early on is that if you cannot do what your app wants to do in paper and pencil, you will never solve the problem with technology. The very first step to having good technology is to understand the logic of the problem you're trying to solve. And so for me, I have been doing about a decade of work recording sales transactions by paper and pencil at farmers markets in Tennessee and South Carolina, and I really did understand every little part about how you record and the ways that that information could be fed back to markets to inform their practice. And so starting off at the high level is really, what is the logic of the problem you're trying to solve? And then you're moving into this process of actually developing, well then, how would somebody interface with a system to begin to answer the questions that will eventually solve this problem? And so this iterative design process, the phases of analyze, design, develop, and test. And we probably had about 6 months or more, actually I'd say 12 months. My very first step with FM Tracks is I work with a computer science student, undergrad from Case. And we started to draw out basically prototypes of what FM Tracks could be. And we were able to share those with a lot of people across the country to say, if something like this was available, would you want to use it? And mostly we were also interested, does anything else like this already exist? Because we didn't want to duplicate. And we kept hearing back, yes, and we want to try it out today. When can we be a pilot site? So that was good confirmation that there was a need. We went through a number of these phases. We interviewed about 16 different people across the country during phases where we would then showcase various features and then get their feedback using questions from the diffusion of innovation model. So if you're familiar with this diffusion theory by Rogers, there are some constructs that were particularly relevant for us when we thought about diffusing a new innovation like FM Tracks. So for example, relative advantage. Is FM Tracks better than what it's replacing? In our case, we're replacing paper and pencil. So FM Tracks has to be better than what you're doing with paper and pencil. And all the advantages of what paper and pencil does have to become available in FM Tracks. Is it compatible? So who are the end users? And this is, again, I remember talking to our development partner, and I said, if we have to make sure the end users want to use it. And he says, our measure of success is that if your end users don't use it, we have failed. And I thought, wow, we need to hear that more in the research arena when we think about developing interventions. Like this whole concept of translation. So he's saying it has to be adopted by them or else it's a failed product. Trialability. What are the opportunities for people to test this out and experience it before they have to make a commitment to use it? What's the time required? Does it take me a month of reading a book about FM Tracks before I'm able to figure out how to enter data in the system? Risk and uncertainty. Can FM Tracks be adopted with minimal risk and uncertainty? And in particular in this one, minimal risk around loss of these data that are really important for me in terms of reimbursement and things like that. Commitment required. Does it take only a modest commitment? And then lastly, the modifiability. Can we update and refine the product over time? And that is clear. I mean, no matter what you're developing, unlike many of us who have developed tools in the past, say we developed a survey or a workbook for that matter, we can develop once and we're done and it's on our website and you can download it as much as you want. And technology is not the same thing. As long as there are people using it, there will be little bugs like we just saw today for no apparent reason. We couldn't get the screen to move forward. And you've got to have backup like Susan here and Lauren who are ready to come solve your problem. So it does require a longer term commitment of resources than say just developing a worksheet or a workbook. Another part of the development process is working through all of the logic of your system. So here's an example of one, what they would call a prototype. Our phase of development was largely prototyping. So basically designing things that look and feel like an app, but they're not at all an app. There's no coding behind it. And so you can see, here is launch the app. And then, you're either going to go to the website or you're going to log in. And if you're going to log in, you're going to select multiple markets or one market. You have to choose your market. But you go through all of the steps that somebody has to go through to make a decision to ultimately get to the point of checking out for the day. This part of the process, if you're thinking about app development, is where you can make a lot of changes in your work. Once you get to the point of coding it, you've paid for the time of those coders. And we've seen this in another app we've developed for a different project. If they have to go back and recode that, whatever it costs for them to code it once, they're going to charge you again for them to code it the other way that you want to do it. So this is your place where you do a lot of modifying, back to that iterative participatory design. You're back and forth with your developer, with your partners, and with potential end users to make sure the logic makes sense. So ultimately, we developed technology that includes, it's an app, it's an iOS-based app, so Apple-based product, and a website designed to collect, manage, and evaluate healthy food incentive program implementation at direct-to-consumer markets. We released the pilot version 1 in July of 2015, and then we released version 2, and I'll talk a little bit about its updates in April of 2016. So it's been out there in use for a little over a year. And, again, a little lesson, I was really reluctant to release in 2015 July, because it's still, Amanda knows, Bridgeport knows, it wasn't perfect right at the beginning there. We had a lot of lessons, but now I can say I think it's better because we were able to learn about all those problems fairly early on. The more people using it, the more problems you're going to find. Because there are a lot of nuances to technology that it's very hard to find those in any sort of developmental phase. And so the main point in FM Tracks technology is this idea of how do we move forward if the idea is that some of the most successful interventions for wide-scale impact for population health are policy, system, environmental level interventions. So if we're implementing these on wide scale, how do we start to collect the same kinds of information in the same way so we can have some measure of impact? Because if I measure it one way and Shachuria measures it the other way, the difference in our measures may be purely due to the difference in the way that we measure our outcome and not to any real change in the intervention. And so this whole idea of apples to apples comparison. And in FM Tracks, we were interested in that same outcome, particularly looking at SNAP use at market and incentive use at market, measured in the same way, collected in the same format. And then 2 additional pieces for us is that we could capture it in real time so that the data would be able to inform future practice and future policy. I presented on FM Tracks in August at the national meeting for all FINI grantees, and the evaluator from WestStaff, who is the external evaluator of the FINI grant, do you know when they will have their evaluation ready based on the 2014 Farm Bill program? Just guess. When do you think they'll have their evaluation results? In 2018 will be the next Farm Bill. 2023 is when they're predicting to have the results. And they said it as proud as a peacock up there, that we will have your report in 2023. And I thought, this is ridiculous. We are in a different era of evaluation. There's no reason that we, as people in prevention science, cannot start to innovate this field to allow us to have data that, first of all, could be much more speedily available. But to me, the more important point is, how do we use it to guide change in practice immediately? Because I don't want to know in 2023. By 2023, everybody will have learned the lessons of whatever comes out in that report. That will be a complete waste of taxpayer dollars, in my opinion. So that, that point of real-time access is really critical, and I think that's sort of on the horizon of where does FM Tracks need to go. We have real-time access, but we don't really yet have the capacity for users to be taking advantage of their data in real time, and I think that's an opportunity for additional innovation. So here's an example of a data dashboard that anybody who's a user of FM Tracks would be able to see. They can see a summary for specific market day periods based on payments, based on incentives, based on transactions. And now moving into that question of adoption. This is a slide, again, we released in July of 15. We looked at the first 9 months of dissemination of FM Tracks. And this is a map of the United States that's shaded. The darker the shade, the more markets in each state using the technology. And you can see Ohio, Virginia, Vermont, and Maine are very high users at 25 markets. And if we look here in Ohio, we have 3 networks that are using FM Tracks. We have our local network here at OSU Cuyahoga County, but of course you can see it's not only in Cuyahoga County. And Amanda could talk more about expansion in the discussion. We have Franklin County or Columbus area, and we've got the Cincinnati network that also has expanded. One of the points, and Amanda actually made these maps for me for this presentation, but a point that I want to make here as we think about statewide work and need, clearly we are high SNAP in our county, but I mean, we have a lot of need in this area of our state. And something to be, this kind of data point helps us also think about where could we potentially target new intervention in the most at-risk areas. So those darker shades on this map are percentage of families with SNAP. That darkest is 21 to 30% of the families or the households with SNAP. So during those 9 months, we were in 18 states and DC thinking about dissemination. We disseminated to 37 regional networks. So our train the trainer model is regional networks are working with local markets. And in total, we were at 273 markets. In all, we had 43,493 sales transactions. I looked at FM Tracks the other day, and it was almost 200,000 sales transactions just since March. This is the largest data set available, the only data set available of national level implementation of healthy food incentive programs. So it's really exciting to be able to start to understand not only, again, our local, and I'll share local data, but also to start to think about national level trends. The majority of those sales transactions are SNAP. So 34,959 SNAP transactions for a total of over $600,000 in SNAP tokens were distributed. On average, for the entire network during that time, the average SNAP transaction was almost $20, which is really exciting if you think about use of SNAP dollars at a farmer's market. During that time, over $480,000 in incentives were distributed, and the incentive average was $12, about $12. So you can see people are spending more in SNAP than they're actually getting in the incentive. And the models of the incentive programs in the national network are very varied. Most of them are a one-to-one match, like our local model, but their caps vary tremendously. Some of them have no cap, one-to-one for as much money as you want to spend. Some are like ours, $10, $20, $5. So features of FM Tracks. Data can be entered in the system by our website or by the app, and they can be entered in as an individual level transaction. That's our main data source in FM Tracks, is a sales transaction. Or they could be entered in aggregate. So I had 100 SNAP transactions for $100. The website is the only place to enter aggregate. The website and the app can be used to enter the individual. The individual transactions have much greater capacity for evaluation because they allow you to track a repeat customer. So ideally, as an evaluator, I would like to see everybody entering an individual transaction, because that's going to give us the greatest amount of understanding for individual level use, especially getting at that repeat customer phenomenon, which from a public health perspective, I think we need to be getting people there. So in our dissemination project, we had 2 phases of dissemination, July through October and then November through March. And you can see the bars here are how data were being entered. So were they being entered in the app individual, or website aggregate? So in the phase 1 dissemination, most data were entered in that aggregate on the website. Part of that was people didn't have iPads, people were learning the system, and again, those are the least, they're very good data, but they're the least complex of the data that we would be able to have in terms of evaluation. Starting in November, we shifted the markets that were open. So a lot of the markets that opened in November were more in the south or the southwest, where winter season is higher than the summer season. So we learned a lot of lessons around how to train people in the technology. They had more time to get the app. And they also had the version of the technology we updated to the website. You could record more at the individual level. So exciting to me is that by March, so over the 9 months, a third for each one, but the majority of the sales transactions are being recorded as individual level, which is really exciting to see not only adoption of the technology, but adoption of that level of evaluation capacity. And then within there, an individual transaction, again, you could record that individual customer ID. And here we're looking at the use of the customer IDs among the markets that use individual transactions over time. So we're getting up to 75%. By the time this second wave came out, the overwhelming majority, when they use individual, were actually using an ID, which would allow us to track that repeat customer.
A real short question. Is that because the seller is actually completing 2 transactions at once? He's able to present the buyer with the receipt, and the information is able to go into your aggregate data? No?
You still have to type it. If you're doing a transaction on your SNAP machine, you would still have to enter it separately on the FM Track. So they run parallel to each other. Ideally, in the future, they could talk to each other better. That would be another opportunity for innovation. So a couple of features, FM Tracks for those new customers. Every time you put in the customer ID, the system is smart enough to see if we already have the ID. If we don't, it would ask these 4 new customer questions. So we'd be able to understand a little bit about who the new customers are. And then every market manager has the opportunity, if they're keeping individual customer IDs, they could then also ask repeat customer questions. You only get 3 questions. That was a lot of back and forth with the field. How many questions would people be willing to answer? And the system is set up in a way that a market can select questions they want to push out, a network, like Amanda could set questions she wants to push out, and then the broader system. So let's say, for example, when I met with the USDA, they said, we want to know the first of the month, every month, we want to push out 1 question to the entire country for every market doing a healthy food incentive question to answer. And so we would be able to get thousands upon thousands of responses to those repeat customer questions. Our repeat customer questions are broken out into community level impact, economic impact, health impact, and then customer satisfaction. We've tried to draw as much as possible on existing measures, so we could compare our FM Tracks data to a national metric. And then FM Tracks, the idea, our main outcome is the transaction, but we want to contextualize the transaction within a market context. So at the end of the market day, farmers market managers can record some information about how many SNAP vendors were there that day, how many total vendors were there that day. They could tell you if they had any events. So for example, did we have a health fair that day? Did we do SNAP outreach that day? So we could start to see, did having those events influence the number of people showing up at your market? And then finally, we ask about market metrics. And again, that idea of contextualizing. We want to know, are you located near a bus stop? Are you located, how is your farmer's market manager paid? Different kinds of questions about the broader market. When we released version 2, we enhanced website functionality. So basically now the website, you can do everything that you can do on the app as long as you have Wi-Fi access. So like on your iPhone, you could do that. The only thing you can't do is those repeat customer questions. You need to be on the app to do that. We refined our technical assistance and training, and then another lesson, again, not something I would necessarily think about as a researcher, but for adoption to increase at the market level, there had to be some business management capacity added to FM Tracks that made it more desirable for that end user. So for example, in the version that came out in April, market managers can now record all of the tokens that they're redeeming from their vendors for SNAP, for produce prescription, for produce perks. So at the end of, and generate a report directly from FM Tracks. That feature has been very popular among most of the market managers. For me, as a researcher, I'm not that, I don't really know what I would do with the data, but that's a good example in dissemination. Some of the features of the tool may have nothing to do with broader evaluation, but they're very relevant to an end user for their increased adoption of the technology or for whatever the product is. Given time, I'm going to skip some of the factors that were influencing adoption of FM Tracks and move. So I just brought up of one of the lessons we learned from interviews with people. I mean, technology comfortability is definitely a factor that influences adoption. Some people are very, very nervous. I mean, it took a long time, and part of it is there were bugs in the system, but for somebody to believe that the system would sync your data to the cloud. Like, all you had to do is log in and it will sync. And it took a very long time to get that point across to many people. I think an additional factor that influenced adoption here is that we had buy-in from this large group like Wholesome Wave who had a grant who's now saying, for you to be able to get reimbursed for some of your incentive programming, you're going to be needing to use the system. So there was a little bit of the carrot and stick approach for dissemination within this particular group of Wholesome Wave network users. However, as these other networks are coming in, I think that as I've talked with them, they're already saying they would present it as an optional feature, and that there probably are going to be some people who self-select in. Some people that have a robust system of evaluation in place, they may be extremely tech savvy, but they're not interested in using a new system because they already have figured out their way. And my challenge back to that apples to apples comparison is that's great, but your data have a hard time then coming into that national conversation about evaluating the program. And so I think that tech savviness could affect at either end, but definitely I think it's something to pay attention to. And for us learning that it's not like you're starting at the app. Some people is, how do I even turn on an iPad? How do I go to the Apple Store and find the app? And so we've actually created videos. I was going to share one video, but I'm not going to help people break down those steps to figure things out. And a lot of it is just meeting with people individually. Like here was a lesson we had. Our tech developer said, this should be so simple, nobody will ever need a training. So I'm like, okay, great, that sounds good. Nobody will need a training. So, you know, we get into about month 4 of dissemination, and it's like crisis. I mean, people are really frustrated. They can't figure this out. So I talked to the tech developers. They're like, oh, we didn't realize that you didn't know that actually means you need to meet with everybody individually and show them how to use it. So that was a learning curve on my part. Like, for example, they gave the example where they had some new technology. They were working with KFC, and a part of their training is every single KFC was met with by the team to train them on how to use this new technology. So that was a misinterpretation on my part. My understanding is it's so simple nobody needs training, and literally they don't need training. That is in fact wrong. They actually do need training. You have to be able to sit there and show them how to do it. And so we had to do a lot of regrouping of how we provide that when we clearly didn't budget to go to 273 markets to show them how to use it.
Is there a plan to move to an Android app as well, so you're not moving into one platform?
Yeah, so we focused on the iOS first because USDA has paid for or provided support for iPads at markets for SNAP. So we thought they would be more likely to have iOS system, but we are interested. It's just a cost. But until there's a real demand for that, then we probably won't transition until somebody says, we'd like to pay for you to make it an Android version of your app.
Do you know, I noticed that the website and the app were about 50-50 in their usage at this point. Is it possible that that 50% is on an Android platform and that's why they're going to the website and not the app?
Yeah, it could be. I think some of it is even people who use the app or the website. I mean, it's designed that the app is used in real time, so you're not recording a paper log. But some people, even observing their practice, like one person will record one transaction in the app, and then the next one on the paper, and then later they'll type it into the app. And then some people record everything on paper, and then they type it into the app when they get back to their office. Markets are really kind of fluid spaces where if you have a big line of people and you're feeling really overwhelmed and you don't want to make that error. Again, I don't want to say you got $10 when you really got 12, or you had $4 and you really had 8. So even in one user, there's a lot of variability in their use of the technology. So if you're interested in funding the Android version, we're happy. It actually can translate fairly easily, but we just haven't really gone after funding to make that happen.
So as we go to the change over time, which is curious. So the longer you look at the same 15 markets, because my first thought was there was such an increase in market
Number of vendors, but not in the fruit and vegetable den. So this is overall, but again, you know, some of the things that we'll want to look at as we're moving forward is how does this affect any one individual market? Dave?
Do you have like a revenue model for this app going forward? I mean, it's going to have to be updated and the nasty story, et cetera. Is there other plans for sustainability in terms of keeping the app around?
Yep. So that's been another big lesson of how do you, again, because it's not free to maintain. A major cost with an app, and I'm saying some of these things now because if I had known all these answers, I might not have done this, but maintenance. So you have to have a maintenance group on retainer. Because today, if a market has a problem, I have to be able to have somebody solve the problem. If it crashes today, I can't say, well, wait, I got to hire a vendor, and then I got to 6 weeks later we'll get that problem solved. Having money to cover the cost of that. So where we are at right now, we are currently in a stage where we are giving non-exclusive licenses to large groups. So Wholesome Way, there's a fee per market up to a cap for them to have a non-exclusive license, which means they can provide it to anybody they want to, but they can't. They can't sell the technology basically. So they basically are renting it from us, and they provide all the technical assistance for their market. So a lot of the cost also in doing this is like enrolling markets and providing all the TA and answering their questions. And like I said, right now we have Wholesome Wave, we have the Ecology Center out of California that hopefully will be coming on board, and then the Farmers Market Coalition. So those would be 3 big national networks. So if somebody said, how do I get FM Tracks? I would say go to one of those 3, and they will be able to give you, provide access. And then they basically, their fee for using it, for renting it, will cover maintenance costs and things like that. And also, if we wanted to do a major revision, like for example, we wanted to add in a whole new feature, we would then need to fundraise around that or write a new grant or whatever. Those would never be able to be covered just with that maintenance or that price per unit fee. So I could tell you all about working with tech transfer. We actually have a very good tech transfer office at Case, and they've been very helpful. But it's, this is very different model of tech transfer than, say, a new drug, which is more in line with what they're used to, or a device that has huge margins for gain. And that's not what this is about. This is really about how do you provide the resources to maintain the system.
Well, what does USDA, it seems like the fee grant would be a place where this would be.
So the new FINI grants, I don't think the RFA has come out. Have you seen it yet? It should be out any day. Usually it's out by now. But my sense is, in talking with the USDA, that they feel like, my belief is that if a group said to them, if in their application they said we're using FM Tracks, that probably would be a good thing for their score. And that's why these other groups who partner with groups writing FINI grants would like to be able to say, well, we could provide that for you. If you partner with us, we can provide you with this asset. So I'm envisioning, because the new RFA is not out yet, that a huge number of markets will be coming on board. I mean, currently there's probably more than 3,000 markets with healthy food incentive programs, and we have the potential here within this. If you're interested, just going to stay in this room and sort of follow up, answer any questions, or really think about take the information and